Hi, I'm Terri Suresh. Welcome to the Wellness Curve. I'm a nurse practitioner and I have an amazing clinic in Texas called Hormonal Health and Wellness Center, and we're focused on giving you your life back. But today my goal is to educate you and hopefully give you some information that might be helpful. Anything wellness. We talk about relationship health, physical health, emotional wealth, and so forth and so on. Today our guest is Dr. Jennifer Ridley, and she's a chiropractor, but she's also very passionate about what we call functional medicine. And Dr. Ridley, welcome to the show, and thank you very much. You know, you and I have a lot of mutual patients, and you know, I tease people all the, or I say it jokingly often when I've fixed their hormones and I've fixed their thyroid and everything, and they're still having symptoms of fatigue and other things, and I'm like, go see Dr. Ridley because she's CSI for that kind of stuff. She is going to figure it out. And that's really what this whole functional medicine idea to me is about, is getting to root cause. But let's hear it from you. You know, talk a little bit about yourself, how you got to where we are, and then let's talk about functional medicine.
Well, functional medicine, as you said, is a philosophy of healthcare that gets down to root cause, and that's what I am very passionate about. My journey throughout life has been to get to a different mindset about healthcare, to stop managing symptoms and get underneath. So I explain it like this to my patients. If you were driving down the road and your check engine light in your car came on, would you ever in a million years dream of pulling over and pulling out the fuse that made that light come on, pull the fuse, and the light went out? Probably not. Hopefully, you would take your car to a mechanic, have them look under the hood, and figure out what made that check engine light come on so they can fix the root cause and make the light go out. Unfortunately, most people in this country with their health are doing the opposite. They're pulling over, pulling that fuse, making the light go out, and expecting to be able to go on down the road and be okay.
Right.
So functional medicine tries to interrupt that and says, stop the madness. We have to figure out what's making that light come on. We have to ask the right questions. What's truly going on under the hood so we can fix that.
Right. And I hear a lot of patients that have seen you that say they were sick and tired of feeling sick and tired. And so a patient that would come to see you is probably one that conventional medicine has failed them. They've gone in for certain symptoms, kind of like they come see me for depression and anxiety and irritability and mood swings, and they're tired of being put on antidepressants and sleeping pills and anxiety pills that don't fix the problem. So in your world, what are some pain points that your patients come to you with?
Well, I take care of the patients that are exactly like you described. They've been everywhere looking for answers, and they keep just getting put on medication after medication that manages symptoms. So my typical patient comes in with a whole bunch of conditions like acid reflux, migraine headaches, constipation, diarrhea, and maybe high cholesterol, and they've just been given a whole bunch of medications.
And tests.
And
scopes and CTs and x-rays and
exactly.
Because we've lost the art of figuring these things out.
Right, and so their labs are starting to come in line, but they still feel terrible.
Right.
Because we've never fixed what was causing all of those symptoms. All that's happened is their symptoms have been managed for them. So,
well, there's usually a backstory, in when people go down a path and decide to choose a certain field, and I'm sure there's one with you. How did you go from, typically we think of a chiropractor as adjusting and body alignment and all of those things. How did you get into this area?
Well, I actually started out in acupuncture. That was my first profession, as it were, and I just realized there was more to health than just treating the energy imbalances. So that's when I started looking at physical medicine so that I could treat the physical body as well as the energetics. And then in treating the physical body, noticed that I could adjust somebody all day long and they still didn't fix everything else that was going on with them. So improving the body from the inside out, then also helping the way they eat, the way they move, the way they think, all of those things play into getting someone to where they feel truly healthy. So that was my goal, to just add enough knowledge to be able to help people eat right, sleep right, think right, feel right.
So the whole concept of functional medicine and those patients out there, which I see by the dozens weekly, and I'm sure you do too, that are really looking for that root cause for those things they're suffering from. Well, just give me some examples. And we talked about, you know, fatigue all the time is primarily one of the ones, bowel issues, some other things. How do you go about delving into that and finding and figuring that out?
So I really practice more of a patient-centered focus and not a disease-centered focus. Right. So in focusing on a patient, you're looking at their whole body. So I start all the way back at the beginning with my patients. What was the first illness you remember having?
Even from childhood, way back.
From childhood, way back.
Got it.
When was the last time you felt truly healthy? And think about that. Think about what true health feels like. And then think about when things started to go wrong. So I look at everything from genetic influences to environmental influences, lifestyle influences, because putting together that puzzle of where they've come from is what helps me figure out what's going on. Because these chronic illnesses aren't the same as the way we treat acute illness.
Right.
So most of the medical model is based around treating acute illness. Somebody walks in with something like pneumonia, you can figure out what's going on pretty quickly.
Sore throat, and right.
Right, and they're able to be fixed very quickly.
Right.
But these chronic, long-standing illnesses, lupus, chronic fatigue, fibromyalgia, Hashimoto's, heart disease, cancer, these you can't fix in 2 or 3 minutes.
Right.
And they all, you may have 5 patients with the same diagnosis, but all have different causes that caused.
Root cause of that.
Right. So you can't figure that out in a 5-minute appointment.
Well, when we come back, we're going to talk about some specific things that Dr. Ridley has to share with how just the media is kind of tainting some of our ideals. So please stay with us. We will be right back. Hi, I'm Terri Suresh, and welcome back to the Wellness Curve. My guest today is Dr. Jennifer Ridley. She's a chiropractor, acupuncturist, functional medicine doctor, and really getting into talking about root cause and what functional medicine is, which is finding the root cause of disease. And there's one thing that I see often in my practice, and I kind of want to touch on it before we move on to commercials and media and what we're being fed, and that is when patients come in and they know that there's something wrong, but they've been to their doctors and they've had all these lab tests and they've been told everything is normal, and then, you know, of course, that's when they get the prescriptions for this and the antidepressants and blah, blah, blah.
Usually the antidepressants, exactly, because nothing on the lab work is wrong, you must be crazy.
Right, exactly.
Right.
Yep.
Well, with those type of patients, what usually is going on is things are starting to get out of balance in the body. Because with almost every chronic long-term illness, it was preceded by sometimes years of warnings of things just starting to slip out of balance. So on a piece of paper, their lab work, their, let's say, blood sugar might look totally normal in the normal range, but if you look back at 10 years worth of blood sugar, it's been slowly going in the wrong direction. And I know you're intimately familiar with hormones. On paper, your estrogen, progesterone, testosterone, normal range. But when you look at the balance, estrogen may be way dominant over progesterone. So it's the devil is in the balance, really. And if you don't have someone watching for that, they're going to keep telling you you're normal when you know something is wrong.
And that's very frustrating for patients.
Yes. So you really need a healthcare provider that takes you seriously and starts looking for things shifting, things out of balance, not just is it completely high or completely low. Because if you wait, for example, till blood sugar is high enough to call abnormal, you're already in diabetes.
Same thing with thyroid, same thing with hormones, same thing with, you know, all of those things. And I love what you're talking about the lab reference ranges and normals, because I see this all the time. And what a lot of people don't understand is there's really no normal ranges, there's expected ranges. And there's a big difference between an expected range and a normal range or optimal range. So when you know, and of course then what happens is when practitioners feed patients with this information and everything's normal, and then it gets into your psyche, and then you think, okay, maybe I am crazy, you know. And one thing that I'm passionate about, as you are too, is empowering people to go, okay, I know there's something wrong with me. And I tell people all the time when I speak in front of audiences, if you know that something's wrong, I don't care if you've been seeing that doctor for, 15, 25 years, find somebody that will listen to you. And we only have ourselves to blame when we don't, right? And how do you get away from all of the media? I was just disgusted. I'd never watched TV, but a couple of weeks ago I was watching the nightly news and, just to kind of see what's going on in the world. But at any rate, there was a commercial break and 5 out of the 6 commercials were drug commercials. And so, we're just feeding people with all of this information again, and they're treating symptoms. How can we turn on the television and see commercials advertising all these things and just tune that out? I mean, what's your thoughts on that?
Well, I don't know that you can tune it out. I just think you have to wake up and know that that's not what you want for yourself. You have to take charge of your own health because no one else will. And health is absolutely a choice. And choosing to do nothing is also a choice.
Right.
If you choose just to accept what you're being fed, knowing that you still feel terrible, that's the choice you've made, and that puts you on a path to getting sicker and sicker. But if you follow your conviction and you empower yourself to go find answers, you have to keep searching till you find a healthcare practitioner that practices what I call functional medicine. Some people call it integrative health, but someone who spends more than 5 minutes with you and will help you figure out
And some people even call it alternative medicine. In our world, we call it alternative to bad medicine. So, well, let's specifically talk a little bit about some of those things people might present with, like acid reflux, insomnia, bowel issues, weight gain, all of those things. Pick a topic and let's just go.
Okay. So I did want to comment something about what you just said about some people call it wellness care, alternative care. Be careful, because there are a lot of people that call what they do wellness, but they're just using vitamins and herbs to manage symptoms as well, right? So you've got to be careful, because just because you're taking red yeast rice instead of a statin to lower your cholesterol, it's no different. You haven't figured out what was driving your cholesterol
up, yeah,
right.
Which I love it when you talk about this, because this is a really, so let's just talk about that.
Let's talk about cholesterol. So cholesterol is a real hot button in our society, because you can't watch a TV show without a commercial on a statin. But if you believe in the body's wisdom, if you believe that this system is designed intelligently, then you might suspect that cholesterol was in your body for a reason. And it turns out that it is. Cholesterol is your body's natural anti-inflammatory, for one, so it goes up in response to inflammation. So if you artificially lower it without fixing what was causing the inflammation, that's going to continue to rage out of control, only now you've taken your body's natural defense mechanism away, which was cholesterol, to go fix that. Your brain is like 60% fat, and a large part of that is cholesterol.
Right.
So healing your nervous system, your body uses lots of cholesterol to do that.
And it's the building block for hormones, and it's the building block for everything, for vitamin D and all of that
estrogen,
stuff.
progesterone, all of that comes from cholesterol.
Well, let's talk a little bit more about that when we come back. When we come back, we're going to touch in a little bit more on the cholesterol piece and a myriad of other host of dis-ease processes that may be a signal to you that there's something else going on. Stay with us. Hi, welcome back to the Wellness Curve. I'm here today with Dr. Jennifer Ridley. She is a functional medicine doctor in the Texas DFW area. Dr. Ridley, we were left talking about this idea of cholesterol and high cholesterol possibly being a warning sign, and how conditioned we are just automatically lower that. And I so agree, because cholesterol is a building block for so many things. Same thing with this whole idea of acid reflux and gastric acid. Let's talk about that. I can't even tell you, it makes me crazy how many people just pop those antacids like candy. So I know that's a hot spot for you.
It is, and it's one thing that I really try to educate people about. There are consequences to just suppressing that particular symptom, because again, it goes back to the wisdom of the body. Acid is in there for a reason. Acid is what your body uses to digest your food. It's also what enables you to absorb your B vitamins. It's also your first line of defense against bacteria and virus. So if you're suppressing acid production, you've just knocked out all of that. So what might be causing reflux? Well, for a lot of my patients, it's a food allergy or a food sensitivity. So I do a lot of food allergy testing.
Or eating too much.
It can be eating too much. It can be that they are just so tired that their body can't make enough acid, because making stomach acid takes a lot of energy from the body. So if you wake up after not sleeping well, you've had a bad day for weeks at the office, your body might start cutting back on acid production to try to give you some energy. Assuming that this is going to be a temporary problem, you'll get a good night's sleep and then acid production can go back to normal. But if it starts to become chronic fatigue, then you start getting chronic low stomach acid.
That's fascinating.
Which means food sits in your stomach and churns instead of getting digested well and starts to bubble back up, creating reflux. So most reflux is actually low stomach acid, not too much.
Not too much.
So taking something to further suppress acid may make the symptom go away, but it makes the original problem much worse.
And it's such a big problem because we see antacids even given to babies and neonates. And what are some long-term consequences of that? Same thing.
Well, think about the fact that that acid was there to help you absorb your vitamins and minerals, particularly intrinsic factor, which gets secreted with acid, helps you absorb your B vitamins. What if for years you don't absorb B12 well? And lots of people have heard of taking B12 shots for energy. Well, for many, many people, that started with not having enough acid or taking acid blocker. And that's just one. There are lots of vitamins that get suppressed with this. Not to mention that you send partially digested food into your intestines. So often it's the beginning of IBS, Crohn's, constipation, all sorts of bowel issues because you were taking that acid blocker. And think about if you're doing that to an infant that can't even speak to all of the uncomfortableness and the tiredness.
Right. Oh, it's just so frustrating. And I know it's, you know, how do we flip that, you know, when you see we're just bombarded with all of this information. And, you know, we talk a lot about speaking to pain, and I'll tell you, Big Pharma they do it really well. They could speak in those commercials to pain, you know, are you having this and waking up with this and da-da-da, take this pill. And it's just a really frustrating message.
You know, I try to educate my patients that you can get to the root cause and make these pain points go away. In fact, it's much easier usually in the end once we treat root cause, because you're really just fixing one thing. What if it's digestive problems that have led to your migraines, to your depression, to your fatigue? So we're really just working on improving the health of the bowels, and then the body heals itself of the rest of that.
And that's really great point to lead into, because psychological issues like depression can be caused not by this chemical imbalance that we need an antidepressant for so much, and oftentimes it's hormone, but you've got some other theories about, you just touched on it, internally what's happening when it expresses as depression and other.
So malnutrition is one of the big reasons for this sort of low-grade depression. Now, I'm not talking about the people that are contemplating suicide. That's a different category. But most of America is just kind of the walking wounded. They're just sort of apathetic, no true joy, no real sadness, just kind of this flat life. So for many people, there is something else going on, that their brain isn't getting the nourishment that it requires. So it starts with digestion, number one, because there are a lot of vitamins that can play into depression. But I'm not a big fan of just going to the vitamin store and loading up on isolated vitamins that have been known to be linked to depression. I test my patients for all of the vitamins and minerals across the board, because just giving isolated vitamins can throw other things out of balance. So you need to know for sure what's low. If you just start taking massive doses of 1 or 2 vitamins that you suspect are the problem, you can really start to throw other things out of balance. Also with depression, I do a lot of neurotransmitter testing, so I'm not guessing about whether serotonin's out of balance, GABA's out of balance, norepinephrine. These things can be tested and then balanced nutritionally, because all of them start with amino acids and proteins in the diet.
And, you know, I not to get on my soapbox, but a lot of people, because people ask me this all the time, well, why doesn't my doctor know about these things? Why aren't these things? It kind of makes our job a lot harder to convince people that what we're saying is true. And honestly, I'll have to say, I don't really have a hard job, because it's what people really already know is true, but they just haven't found the right person. But, you know, to speak to that, you know, and I always defend conventional medicine to a certain degree, because we get our education from the pharmaceutical industries, from profitable industries. So, you know, changing that mindset in conventional medicine, kind of shifting the mindset away from just the band-aiding symptoms and things like that.
It all has its place, right? Traditional medicine absolutely has its place, and they're experts at things I don't even begin to understand. But when it comes to nutrition, I'm the expert. So that's the difference.
And figuring out why is nutrition not talked about in medical schools. That's a big one.
They really don't. They're not trained in it. And
that's a whole like big show that we could talk about. So stay with us, because Dr. Ridley and I are going to touch on a little bit more. The big, hairy, ugly that everybody wants to know is, why can't I lose weight? So we're going to touch on that and touch on a little bit about how to learn more about what she does and how to work with Dr. Ridley. We'll be right back. Hi, I'm Terri Suresh with the Wellness Curve. Welcome back. Dr. Jennifer Ridley is my guest today, and we're talking about finding root cause of the things that ail us: depression, anxiety, mood swings, stomach pain, a myriad of things that we deal with, that we visit our conventional practitioners for every day, and unfortunately most often are band-aided with prescriptions to fix symptoms and not really fix the root cause. So we finished the last segment and just given a little teaser about weight gain and why is it so difficult to lose weight. And again, this could be a whole 30-minute show in and of itself, but just your top pain points on that, and just pearls of wisdom to share of how what you do and what you discover plays a role in managing weight.
So my first question to people with weight gain or weight loss problems is, when did it start? Is this something that just recently happened, or have you been dealing with this for a very long time? Because those are two very different people. So if it's a very short time, they've usually just started eating wrong. It's a quick fix. But for the people that have tried everything, they've tried diet after diet, they exercise all the time, they keep gaining it back, or they just can't lose it, we know for those patients there's something else going on. It could be a hormone imbalance that needs to be addressed. Estrogen, progesterone being out of balance can make weight loss very difficult. It can be that your adrenals are not doing their job, and very few physicians actually test for adrenal fatigue. And they're a big player.
Well, they don't believe in adrenal fatigue.
And it's a big player in metabolism and energy. Same with thyroid. And a lot of people have had their thyroid tested and have been told that it's totally normal. But a sluggish thyroid that's within that normal range can really contribute to weight loss problems. And then most importantly, what I counsel all my patients on is a body under stress does not lose weight.
Right.
So whatever that stress is, for most of my patients, it's chemical stress. They're still drinking the soda. They're still drinking, eating the artificial sweeteners, the chemicalized food. And so they're keeping their calories down, but the quality of food they're putting in their body is creating massive stress inside. So as long as you're under lots of stress, whatever's triggering it, it's incredibly hard to lose weight. So for my patients, I help them dig through their life and see, are you exercising wrong? Are you exercising to the point that it's causing you stress? Some of those marathon runners that can't lose weight, it's because they don't give themselves enough exercise recovery time. Right. Are you, even though you're keeping your calories under control, choosing the completely wrong foods? And I illustrate that with my patients. If you had a 500-calorie diet today, or 1,200, something more realistic, but you ate 1,200 calories of Snickers bars or 1,200 calories of broccoli, which day do you think you lose weight?
Right.
The body knows the difference. It's not all about calories. So getting the foods right, and for me, I do a lot of food allergy and sensitivity testing, because sometimes a health food could be a problem if you have a real sensitivity to it.
And these are things that you may not even know. For instance, I always kind of share this story, and I have several of them now that I've been sending patients to you, but I had a particular patient that I sent to you that hormones balance, thyroid balance, and I really am liberal with thyroid, because this whole thyroid resistance and type 2 hypothyroidism is a big deal right now. Well, it's always been, but it's coming to light. But really couldn't still figure her out, and I saw her a few months later, and she had already dropped 20 pounds, and she said, if you can believe, I was allergic to coffee. Coffee. We think of when we have an allergy that we break out in a rash and we have this head to toe thing, And so who knew every morning when she has a cup of coffee, it was creating this inflammatory response. So briefly touch on that, because I think people they think, well, I don't have any food allergies because I've never broken out.
Right. So there's two different kinds of antibodies inside of you. The kind that's on your skin is what allergists test for with the skin testing. So a lot of people have had the skin testing for food and been told they're fine. But you don't smear food on your skin.
Right.
So what needs to be done is the blood test, which is an IgG test. It's a whole different kind of food allergy test that tells us what happens once the food hits your bloodstream. So it may not be hives at all. It could be anything that inflammation is a problem for. So once you eat a food that you have a problem with, it creates inflammation in your bloodstream. Now anywhere the blood goes can have symptoms, and it's different for different foods and different people. Everyone is very unique in this regard. So for some people, this creates loss of focus. So a lot of the kiddos I help with ADD and ADHD, once we figure out their dietary, what's good and bad for them, their focus recovers remarkably. Migraine headache, same thing, often goes back to something in the diet. And all of these foods that you might ingest, if you're creating an inflammatory response, that's stressful, very stressful. And that goes back to high stress, your body doesn't lose weight.
And chronic stress and chronic disease and chronic disease processes throughout the lifespan, cancers, diabetes, blood pressure, cholesterol, all of those things that we talked about. So your mission is to change the way people think about their health. And what do you mean by that?
I want people, number one, to feel empowered that they're the ones that have to live with this body. And number two, I want them to start thinking about health as vitality, not as an absence of symptoms.
Right.
Most people think about health, if I can keep my cholesterol low enough, or I make my headaches go away with these pain pills and I take my Ambien, I can still sleep, that they don't still have these problems. That's not,
they still exist.
That's not true health care. So I want
it's like, if I don't look at my checkbook balance, then it's not zero really, right?
Right.
It's kind of like ignoring things.
So it's teaching people that they can be truly healthy and vital again. And that comes with improving the function inside the body and then letting the body heal itself.
Well, how can people get in touch with you if they want to work with you, and even people that may not live locally? I know you do some long distance care too.
I do. So I think you guys have my website up, so certainly you can contact the office if you're local. But I do work with a lot of people at distance by getting in touch with their family care practitioner and arranging to have the lab work drawn that we need, and then I can work with them over the phone to further go into those labs and how we can help them.
Well, Dr. Ridley, thank you very much, and we're hopefully going to have you a regular guest because, boy, we have a lot of topics we could cover, myriad of topics. So thank you for being on, and thank you for listening and tuning in. If you caught the end of it, Dr. Jennifer Ridley, livewelldfw.com, and I'm Terri Suresh, hormonalhealthandwellness.com. Thank you so much, and have a great week.